welcome back to The Factor Uncensored. The chief of the World Health Organization declared that the COVID-19 pandemic ended back in May. However, the threat of the virus and infections are still lingering. Dr. Danish Ali is out with an important reminder for everyone tonight: mask up, wash those hands, and sanitize. Dr. Danish Ali from Archpoint Pain Institute is here with us on The Factor tonight. Dr. Ali, many doctors are recommending that you don't get your booster shot for COVID just yet. But before we get to that, we've seen a significant increase in cases. Are we looking at a bad winter ahead?
Isaiah, I think so. And the reason why is we're seeing some of these mutations, some variations that are coming out in the COVID strain. And because of that, we're seeing more infections. The amount of cases of COVID have doubled just within the last couple of weeks because of a new variation that has come out. Thankfully, that has not resulted in significant increases in the number of hospitalizations. However, historically, those numbers generally lag as well in terms of hospitalizations. People generally get sick, they wait a long time, they try to stick it around at home, and then once it's more complications that they may be having, then they end up in the hospital. Therefore, I do anticipate that we're going to see a little uptick in the number of cases that are presenting to the hospital because of the new cases that we're seeing. Again, people are not testing as much as they should be, or they're doing those home tests. So I think that these numbers are a little skewed. I think they may be a little bit higher than what we're actually seeing.
Do you think people have just kind of forgotten about COVID? Only those who may be impacted, those who may be affected by it, or they think, okay, I have a summer cold, and they're not getting the proper tests done.
Correct. I think that has been the case. I think we've kind of forgotten about it a little bit, unless, as you said, either you've had a family member that's been significantly affected with it or died with it, etc. And so, yes, I think that we need to really be aware that it's, especially with the winter season coming up, especially with those holidays, people going back to school. But to go back to your initial point, yes, currently, because of some of the newer variations of COVID, we're currently recommending, unless you're at a high risk, like you're immunocompromised, for example, Isaiah, or if you've got other medical complications, or you are around folks that, for example, healthcare workers, right? Mm-hmm. Unless you fit in those criteria, we're asking folks to hold off until a new variation of the booster comes around for folks to get that, so they can be better protected with some of the newer variations that we're seeing in the community at this time.
Now, there was a time when the government was providing many of these shots, these boosters, the vaccine, all free of charge. Are those days over with now, or do you have to rely on your insurance or come out of your pocket to pay for these boosters and vaccines?
There are programs, Isaiah. Currently, the insurances are paying for them. If you're self-pay, they are very inexpensive. There are some other places, like community clinics, that you can get these at that are either discounted significantly or even free. So there's a lot of options. I'd suggest to go to the CDC's website or to the local Harris County website, where they have areas where you can get the boosters and get the vaccines from as well, Isaiah.
And if you're seriously concerned still in 2023 about getting COVID, it being transmitted to you, would you still recommend the mask? I mean, you stick out like a sore thumb in public now, but some people still wear their mask.
Isaiah, yeah, I was just out shopping over the weekend and people were still wearing their mask. And yes, I think if you are immunocompromised, you have other health complications, you're at a higher risk, those are all reasons where you need to look at the benefits versus a risk, right? That's the whole biggest thing that even in the medical community, we're always thinking about. or the risk versus benefits. You know, the risk of putting a mask on is minimal to none, right? I mean,
Right.
you don't have to smell somebody's breath, right? So all those reasons, you know, the risk of it is very low, and potentially the benefits are a lot higher, especially as we're seeing the number of cases increase, Isaiah, as we're, especially if you're around folks that may have COVID, if you're in airports or in other closed environments, you know, stadiums, healthcare, hospitals, those sorts of things. Put that mask on. It doesn't hurt. Wash your hands. Use your hand sanitizer and keep it close to you right here. So keep that hand sanitizer nearby as well.
All right. Send me a jar over here at Fox Studios, Dr. Ali. Always good to see you. And we appreciate your time on the Factor Uncensored tonight.